This is Dr. Cummins. Wanted to go over procedural sedation and the correct way to do it with the power chart. Even though we're going to Dyne Doc in a few months, it's important to get this right. So quick tips. We got to fill out every line of the procedure note, okay? And then we cannot say see nursing notes, which is an option. We have to actually document something else for it to count. And remember, this is huge for billing. You have to have intra-service time greater than or equal to 11 minutes. So typically I just say 15 minutes, right? So this is the time from when we push the medicine to when the patient wakes up. So typically, even though the procedure is only a few minutes, they're sedated for 20, 30 minutes. You don't have to put the start time or the end time. It's all about the intra-service time, all right? So let's see how we do it. So like any other procedure note, right? You go into the procedure note section, you right click, you hit the insert sentence, you scroll down, and then you're gonna find the pre-sedation info. Click both. You gotta do both, not just procedural sedation. And then literally there's about 20 plus lines. You gotta go through every one, right? And if you're not sure, you can always ask the physician you're working with to go ahead and go down. And each one is important. And then you see, I'll go down to anesthesia, history, oops, I skipped, last time the patient ate or drank. That's somewhat important. If you can get that information, that helps us. It's not a deal breaker though. And then just keep going, that's important. So any complications in the past, make sure you throw the diagnosis in, right shoulder dislocation. Consent is pretty much always signed, right? And then you wanna click all four because we have all four for sedation ready to go. Again, do not hit see nurse's note, hit reviewed. And then here it is, total intra-service time. Put whatever you want as long as it's 11 minutes or greater. And then choose the type of medication. Here we use propofol, IV, you don't have to put the amount. And then monitoring, of course we did, continuous blood pressure. And then just keep going down, hit every single box, usually on the left. And that's it. You have just documented the procedural sedation in about 20, 30 seconds, okay? So next, we're gonna be transitioning to dynamic doc, right? I know you've heard about this. It's mostly auto text and there's not any click boxes as much anymore. I created this pro.sedation, so pro short for procedure.sedation. It's gonna be the one we're gonna be using for this. I mean, technically you can use it now if you want, but it's only for Dyne Doc. It doesn't work in the power chart. So we will be moving to this. There'll be more education on that. So here's a couple of examples of fallouts, right? So some people think that, oh, well, the fracture dislocation procedure or the cardioversion procedure, it has sedation in there and we can just put the meds and monitoring. Unfortunately, that's not good enough. It's not good enough for billing and it's not good enough for compliance, right? So we got to have that full note. Here's another example on a fracture reduction where we just put the procedural sedation in and monitoring, which is great. You can put that in the actual fracture dislocation note, but it doesn't count for the sedation note. All right, this is getting a little better. This time we at least put the procedural sedation note in, and the intra-service time's 11 minutes. Awesome, but we forgot to put the pre-anesthesia information in. So you got to click both those boxes like I showed you. And then last but not least, this note was dang near perfect. Good job, Abby. The one thing we forgot on here was just the ASA classification. I don't expect you to see that in there, but it just shows you that we just missed one tiny little box and it fails compliance, so it's a fallout. If you have questions about this procedural sedation stuff, let me know. It's pretty important to Banner and CMS. They're reviewing these manually every single day. So they look at our charts, physician charts, to make sure we're documenting what we can. All right, guys, thanks for listening.